Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad. Today we will discuss about the asthma. Asthma is the disease which is a chronic disease. Either it is from the childhood or middle of the age, like younger age, because of the damage to the trachea. The trachea is nothing but the air blowing for the lung. So obviously, when there is a congestion in the trachea, where the air passes from nose and mouth to the lung, where there is a spasm in the muscles, either spasm or the infective nature leads to the congestion in the trachea, leads to the asthma. It could be upper respiratory infection or lower respiratory infection, either of it. The bronchioles which get clogged or congested, then the asthma rises. The asthma is nothing but the shortness of breathing or difficulty in breathing. So obviously, when we should rule out the pathology, where exactly the pathology started, whether it is the upper respiratory or the lower respiratory. Either of it, if it is neglected, lead to complications in the type of pneumonia or congestive lung failure or chronic obstructive pulmonary diseases. So the most important is certain people will have asthma because of allergy, and certain people will have asthma because of the infections like bacterial, viral and fungal infections. So when we know that the specific cause is there, or whether there is a mechanical cause like damage to the trachea or the bronchioles, alveoli, leads to asthma. So either of it, certain families in hereditary form get asthma due to their family history. So obviously we must know that the cause for the asthma, whether due to it is a pathological or allergic or hereditary or any other mechanical block in the air passage area. So these are the points where we must rule out the cause, and then most of the people suffer from the allergic infections. That allergic infections will retain for throughout the life, where these people has to stay in warm temperature areas where they should take care of their cold weather effect, and then they should take care of the consumed chilled alcohols or chilled water. Certain these stimulants will aggravate the spasm in the trachea, leads to asthma. So obviously, when you know that the specific bacteria or fungus or the virus is infected, that specific cause to be removed within a medicines, which helps you to control the asthma. So where there is a spasm in the trachea also need to be treated along with the pertaining to particular cause, then the asthma could be controlled. So obviously this patient has to undergo regular investigations like blood tests, X-rays, CT scan, if necessary MRI, to rule out the major cause in the trachea or the bronchioles. So when we understand the diagnostic tool that the particular cause is causing the asthma, that particular cause to be treated like antibiotic, antiviral drugs and antifungal drugs, along with the steroids to decrease the inflammation and reduce the spasm, and then anti-allergics to remove the allergy. Apart from this, sometimes these people may lead to severe chronic pulmonary lung diseases. That time they should be admitted in respiratory intensive care unit and subsequently treat the patient so that they shouldn't go up the ventilator support.